He has very successful rate of treating patients with PRP and stem cells therapy. IAS officer of Karnataka. What are these therapy and how these therapies work in actual things?
I think in the future, less and less number of people will probably need even the ACL ligament arthroscopic surgery for sports injuries. Some will always need it, but many may not. Millions of people, crores of people in India suffer from knee arthritis and related pain. Stem cells are the cells which have potential to develop into anything. In here, what we are using is Government of India regulator body approved bone marrow derived mesenchymal stromal cells from very well vetted young donors.
Whereby 25 million stem cells are introduced into both knees.
Collagen is part of the cartilage matrix, but
So we are
collagen is
just
not
putting outer substance into it. We are not regenerating anything. It's just like
well,
that.
we are replacing some
Just
collagen which is
replacement.
missing, which is an integral part of the cartilage. So it is in a way partially healing the cartilage.
All the people, and this is where the average median age is 100 plus. The one common factor is mobility.
In the stem cells and PRP therapy, is there any role of physiotherapy?
So yes, physiotherapy is incredibly important, and it has to be done for a number of months. If you want to regain youth inside your body, you got to put some effort.
Greetings everyone, this is Khyati Chauhan, your host. I'm a physiotherapist, and today in our pain-free knee series, I have got some spicy topics to talk about. So we are talking about the alternative therapies that we can use in the knee replacement and biological knee replacement, mechanical knee replacement. There are so many things. So I was very confused about the things. So I called some experts who can help us in that. So let's introduce them. So Dr. Keur sir, Dr. Keur Buch, who is a leading orthopedic surgeon and has worked like 25 plus years in UK and USA, and now come back to India serving their people. And he has very successful rate of treating patients with PRP and stem cells therapy. And again, we have Dr. Gauri Trivedi ma'am, and she is a ex IAS officer of Karnataka and also president of Karamsad Medical College, and so much more. I don't even remember. These both have achieved so many things. So now let's get started into the topic. So I would like to talk to Dr. K. Buch and ask him about the PRP and stem cell therapy. Like, what are these therapy and how these therapies work in actual things?
So hey guys, namaste. And Khyati, yes, you have brought up this very relevant and important topic because millions of people, crores of people in India suffer from knee arthritis and related pain, and also from sports injuries to the knees because sports is becoming very, very popular. Khelo India, and overall it is a healthy activity, but there are some injuries. I have been involved in what I call as regenerative medicine, which has been approved now as a medical faculty by the US FDA as well, in orthopedics for over 20 years. When I was in England and thereafter when I was in Bangalore, we were one of the first team to do successful stem cell therapy for avascular necrosis of the ankle as well as for the cartilage damage to the kneecap, the so-called chondromalacia patelli. But more recently, we have evolved into a high-quality platelet-rich plasma treatment, which basically is the concentrated platelets from the patient's own blood, so there are no allergic reaction to the PRP because it's your own blood. And then we combine it, the high dose of PRP, and the dosage is now we know because it's an evolving therapy. There are studies to show that 8 ml of PRP is better than 4 ml, etc., etc. And we combine it with high grade hyaluronate, sodium hyaluronate, and that seems to be giving us very good results in selected patients. And then, of course, the cartilage regenerative cells, which we can only get from the stem cells, that we have been using recently, what is known as bone marrow derived mesenchymal stromal cells, and that is approved by the CDGC, or the Drug Control Organization of India, and also by ICMR, Indian Council of Medical Research. And there are prospective randomized studies from over a year ago now, uh, in more than 140 patients, showing the efficacy and effectiveness of stem cells. So, yes, it is known, you quite correctly mentioned, Khyati, as biological joint replacement. And I think in the future, less and less number of people will probably need even the ACL ligament arthroscopic surgery for sports injuries. Some will always need it, but many may not. And then very few people may end up needing even metal and plastic artificial joint replacement.
Okay, sir. So, can you tell me the difference between the PRP and stem cell therapy?
Okay, so I'll talk about PRP and little bit technicality of stem cells, and then Gauri madam can talk about the stem cell side of as they say, the first-hand experience and detailed interest and knowledge seeking as well. Which is actually at the risk of digressing a little bit. It is so good to see this cutting edge interest, actual interest in the cutting edge technology in what people call as bureaucrats, And I think if there are more IAS officers like yourself, Gauri, and I've never said this to you in person, but I'm saying this in public now, then the job of the current government of India to enhance the leap in technology would just be phenomenal. So with that digression, I'll come back to the difference between PRP and stem cell. So platelet-rich plasma is your own blood, which is put in a particular machine, and the platelets are the cells which contain growth factors, PDGF, platelet-derived growth factor. They are concentrated to a significant number, and then they actually reduce the effect of negative chemicals which are accumulated in arthritic joint, like interleukin 6 and tumor necrosis factor, TNF. So that is the specific role of the platelet rich plasma. However, it works better. There are studies to show from Italy and other European countries, from Taiwan and also from India and China, that when the PRP is combined with hyaluronate, the results are longer lasting, and a patient overall gets. And I have now this experience in India, although previous to that I was in UK and US about 25 years. In India for last 8 to 9 years, barring the 2 years of COVID, of course, that this PRP, high dose PRP and sodium hyaluronate combination in appropriate dose and delivered in a technically perfect way has actually very encouraging results. Stem cell, I'll just say a couple of things and then Dr. Gauri madam can take it further. That stem cells are the cells which have potential to develop into anything once you implant in certain part of the body. They take the local characteristic. In here, what we are using is Government of India regulator body approved bone marrow derived mesenchymal stromal cells from very well vetted young donors. So, therefore, they are very effective in people above certain age because their platelets may not have that many growth factors. So as a result, that stem cell therapy has its own, and then it is combined with the hyaluronate so that it provides a scaffold for the stem cells. But Gauri ji, आपका जो experience or insight that you can share, I think will be very enlightening for everybody.
Sure. Thank you very much for inviting me to this podcast, Dr. Keur and Dr. Khyati. And I'm delighted to be here, not only because I would like to share my experience, but also to let the public know the advantages of doing stem cell therapy rather than an operation where your knee is replaced or the joint is replaced, because that has certain side effects. And I have not found that to be true in stem cell therapy. As Dr. Keur just explained to us, that there are two kinds of stem cells, and what the ones which they inject into the knee, which they did for me, is the mesenchymal stem cells, which are from healthy adult bone marrow. There are the other kind, which are the pluripotent stem cells, which come from the embryonic blood of a newborn baby, but those are not used for stem cell therapy in region. If I have to talk about my case, as you've requested, I have been a chronically arthritic person. It's probably there in a hereditary kind of way, And over the years, I was very active in sports. I have had injuries in both the knees. In the right knee, I have um, got a cracked knee along with in a skiing accident with a tear in the meniscus, the ACL, and the lateral ligament. So that they told me would probably not get repaired, and I would need surgery. But fortunately, there were doctors who had faith in alternative therapy, and of course, at that time there was an arthroscopic surgery which took place. But on the left knee, because that took time to heal, the left knee also had a meniscus tear, and I said I will not go for any kind of surgery. Let me try stem cell therapy. Before coming to Dr. Boch, I had an introduction from Stemputics. They are the company which is promoted by the Manipal Group, which have created the vial whereby 25 million stem cells are introduced into both knees. And it was kind of magical because I had come into the hospital. O- I mean, it was the OPD ward, and I had come in with a slight limp. But after the surgery, I immediately almost started after the injection, I almost immediately started feeling better. So I think if one looks at it that way, after a surgery, there is post operative care. There is the factor that you might have infections because not because of carelessness of your surgeon or your staff, but because of dressings or patients who are, nearby or relatives who visit you. All that is missing in stem cell injections. You come in, you take the injections, and in fact, Dr. Butch was so careful. I said, "Oh, are you going to at least freeze my knees so that I don't have any pain?" And he said, "No, you'll have to tolerate that pain because I don't want the stem cells to get damaged. And they could potentially get damaged if we give you nitrogen to freeze the knees for pain management." And he also suggested after the stem cells are given that for a few days, I do not use very hot water or very cold water or packs on the knees because the stem cells which are there need to settle down and start regenerating. Over to you, Dr. Khyati, again.
So, ma'am, how was your uh, journey after the procedure? How did you find it, your recovery, and like moving on to your daily life?
So, as I said, I'm chronically arthritic. People have always told me I'm at stage 4 arthritis, and I have this shooting pain which is from the knee to the left hip, especially on the left leg. But almost immediately, within 3 days of taking this injection, that pain disappeared. And now I can't say that I run or that I exercise like a typical sportsman, but every day I can walk for a good 45 minutes to 1 hour without any pain. I walk at a normal pace, and I think it's very important even after the stem cells settle down that you do continue to have exercise. And one thing which I would suggest to patients is that for anything related to the knees, you need to keep your weight down. You should not, because 1 kilo of weight which is extra on your body is actually 10 kgs on the knees. So it's very important that you think once you've done stem cell therapy, it's not like magic where you can just give an injection and you do need to have exercise, you do need to follow a daily regime, you do need to be careful about your diet. But yes, as an alternative theory, I would say it is much more likely to be an advantage than normal surgery. Over to you, Dr. Butch, if you'd like to add anything to what I say.
So, I was asking that what kind of patient is appropriate for this thing, for this procedure?
So we are talking about two types of treatments. One is platelet-rich plasma with hyaluronate, and the other one is stem cells with hyaluronate. Typically, and we are talking about knee arthritis. So say let's talk about above 45. So between 45 to 60, up to 65, depending on general health, one can use the platelet-rich plasma uh, in appropriate dose, and that's the key thing. Which I think I was at leading global orthopedic conference in France just a couple of months ago. It was pan-European, and there were surgeons from entire Europe and USA, where I presented a paper, but also I was part of this session on what is known as joint preservation and the regenerative aspect of orthopedics. It was a bit sad that I was the only orthopedic surgeon from India in that meeting, in that
Okay.
session. But at least I was there, and so through this podcast, and we can convey the message to, especially the younger orthopedic surgeons, because I think they are more open to newer ideas. And I think the definition of youth in my mind is anybody who's open to good new ideas, not just new ideas.
True.
Good new ideas is young. Call me what you like. So the thing is, this PRP, there are few other factors. The patient shouldn't have untreated osteoporosis. The patient shouldn't have uncontrolled high serum uric acid. The patient shouldn't have extremely low hemoglobin. Uh, the patient shouldn't have extremely low vitamin D3 and extremely low vitamin B12. So we rule all that out first. And the arthritis should not be grade 4. Grade 2 to 3 is fine. Grade 1 is too early, and physiotherapy and simple medication should help. So it shouldn't need any injection. So grade 2 and grade 3 arthritis of the knee is in a properly selected patient, as I mentioned already, and properly optimized patient. Because even in that selection group, if the patient is then not optimized by getting their uric acid to normal,
Yeah.
getting their vitamin D to normal, starting them on treatment for osteoporosis, if you don't do that and then inject PRP, and that also in low dose, then say, oh, PRP doesn't work. And then you get 75 orthopedic surgeons like that all saying, oh, PRP doesn't work. Opinion is very cheap. The thing is that even the regulatory and advisory councils in various parts of Europe, USA, UK, they haven't caught up with this technology to the level that the scientists have developed, and they are
Okay.
lagging behind. For example, because my background is from UK, we have British Orthopedic Association, we have BASC, British Association for Surgery for Knee, and we have NICE, National Institute of Clinical Excellence. Guidelines from NICE are followed all over the world. But if you really talk to orthopedic surgeons and other doctors in private in the UK, they will tell you that NICE actually stands for National Institute of Cost Effectiveness, not National Institute of Clinical Excellence, because they have a mandate. And therefore, you see, there is a shlok in Bhagavad Gita where it says, whatever the great and the good do, the rest of the people follow that.
Follow, yes.
So if you look at the big sports people from USA, from UK, from India, like Sachin Tendulkar, if you see what they are doing, then a lot of them have had PRP
Okay.
long before people even started talking about it. So, so there is a reason, because they have access to the latest technology and presumably the best advice in the world. So, so that is the PRP side of things. For stem cells, patients above the age of 60, specifically above the age of 65, will be more suitable because their platelets may not have so much PDGF in them. But up to 70 is the cutoff line, really. And between 60 and 70, you look at individual patients' overall health and hemoglobin, and then decide about stem cell. Another thing about stem cell, which I'll just add to what Dr. Gauri Trivedi madam said, is that another type of stem cell, which is known as autologous stem cell,
Okay.
where you take cartilage from the patient's own knee,
Mm.
the non-weight bearing side of the knee, through a keyhole surgery, arthroscopy. Then you send it to the lab and it regrows into a lump of cartilage cells,
Okay.
and then you reimplant, but it requires two actual operations
Operations, yes.
under anesthetic. So
Okay.
that's very invasive,
Yes, I guess.
and therefore uh, the PRP and the actual bone marrow derived mesenchymal stromal cell therapy, which is, actually it is pioneered in India.
Yeah.
Make in India. The technology. It is a fact that BMMSC technology is pioneered in our country, Bharat, India, and already prospective randomized study in a high impact journal, the American Journal of Sports Medicine, has been published in it. So we have a scientific backing, and I'm sure rest of the world will catch up with us one day. But right now you will hear a lot of negative talks about this therapy, because those who haven't bothered to acquire the knowledge And acquiring knowledge requires hard work. You have to wake up till late in the night, and rather than watching funny reels, you have to actually read the orthopedic journals.
Correct. Yeah, that's
And you have
different.
to invest your time
Time.
in proper meetings. I mean, I spent, I don't know how many numbers of lakhs of rupees going to France and attending the meeting. So it's not easy to acquire this knowledge, and therefore it is very easy to kind of belittle it.
Mm.
But we have, one of the most enlightened and educated brains sitting here. And,
No, no.
she has done a lot of study before she decided on. And I know Brian Johnson, just Google him. He's the longevity guy, the longevity guy on the face of this planet. Just recently, he had stem cell injections in both his gluteus medius tendons, both his shoulders, both his knees. He's 48, and his aim is to ensure that he can help this research to an extent where a 48-year-old can actually have joints of an 18-year-old.
Yes.
That's where the science is going, and we can't be left behind.
That was the thing that why, sir, I really invite you to this podcast because I've met several orthopedics and physiotherapists and also patients, and they be like, no, PRP doesn't work. It's not worth it. We does not have seen any success rate into that. So they're always denying the fact. So thank you so much for enlightening us on this topic. So back to Dr. Gauri ma'am. Ma'am, would you suggest people the PRP and stem cell therapy?
I wish I had been younger when this all started, but at that time it hadn't been certified. So there was no way I could get access to PRP therapy when I was in my 40s. And by the time stem cells became, the future medicine, as we call it, the regenerative aspect, I was already in my 60s. So I'm very, very happy with the stem cell injections. I'd like to place on record how gentle Dr. Butch is. He was still talking to me. He said, you have to put your feet at 45-degree. And I said, oh, is it going to hurt? And he said, no, no. And when we were in the outpatients OPD, there are a whole lot of people who were watching, but he was so gentle, and he said, oh, the stem cells I've already injected. Now we're keeping the needle inside. So I said, how is that going to help? So he says it acts as
Scaffold.
a scaffold for the stem cells so that they can then start their work much easier. They form a kind of barrier so that outsiders like normal scaffolding in a building.
Yeah.
But yes, I think both PRP and stem cell therapies are excellent. uh, for PRP, as Dr. Butch explained, you have to be healthy, you have to be in your maybe up to the age of 60, but I would recommend that postmenopausal women, it's more difficult because you need to have the correct amount of hemoglobin, you need to have the correct amount of vitamin B as well as vitamin D, and that is not normally there for Indian women. We're much more housebound, so they are, their own blood is perhaps not ideal for PRP. It is definitely ideal for stem cell therapy. So I would urge anyone who is listening to this podcast and is interested in a pain free life in their later years to consider these therapies, because it is a much better, of course, cost effective, but it is also much better as a healing process for you to have stem cells or PRP treatment rather than a normal knee replacement surgery, which most orthopedic surgeons recommend, because let's face it, that is one more notch in their career.
So, sir, I've been updated by this thing. Germany just had launched a gel, like cartilage gel, meniscal gel. I don't know. So, what are your opinions?
Right. So, social media has tremendous impact on people's lives, on their thinking, and their even decision makings nowadays. And I'm not saying whether it is good or bad, because it's ultimately up to us to filter things. This this German gel, as people have been circulating on social media, is actually a collagen matrix patch, and has been around since 2013, 12 years. So it's not something new.
Yeah.
Secondly, it requires actually a procedure, arthroscopic procedure.
To insert
So it's
it.
an invasive procedure. And then again, you are then expecting that gel to take over complete function of cartilage rebuilding. So we have to wait for the long-term studies. There is no direct cartilage cell growth inducing factors in that gel. So it collagen is part of the cartilage matrix, but
So we are
collagen is
just
not.
putting outer substance into it. We are not regenerating anything. It's just like
Well,
that.
we are replacing some
Just
collagen which is
replacement.
missing, which is an integral part of the cartilage. So it is in a way partially healing the cartilage, but you don't have the mucopolysaccharides, you don't have the platelet derived growth factors, and it doesn't counter the interleukin 6 or tumor necrosis factors. So, and it is not new. But I'm not saying that it is one of the options. There are many other options as well beyond the PRP and the stem cells, nucleosomes, and many other kind of cells which will interleukin 10 related materials. And this field of, it's amazing. Orthopedic surgeons have been thinking about it for years now, although talk is only now. When I was attending a consultant orthopedic surgeon interview in the UK in 1999,
Wow.
these are very serious interviews, by the way. And I was asked by my, the interviewing. I was a young orthopedic surgeon after my FRCS, MCH orth, and FRCS ortho, and all that, and with of course MS ortho background from India. And he asked me, the senior guy who was on the interview panel, that Mr. Butch, because once you do FRCS, you get a higher title in England, and it's
Yes.
called doctor, and then you become a Mr.
Mr. Yes.
So he said, Mr. Butch, what do you think of biological joint replacement? And I thought this was a googly and a bouncer put together into one. Thankfully, I was interested in regenerative medicine from the very early days, even when I was in medical school in India. And so I'd done some reading about it, and I said I can probably think of it as something in the future. And he said, what if I tell you, and this was in 1999, that there is already work going on
Wow.
in this field at the moment.
Wow.
And there is a famous orthopedic hospital in London called RNOH, Royal National Orthopedic Hospital, where Professor George Bentley actually started this work in 1990s. So it is not completely new, but like any technology which is uh, uh, changing the pattern of how you do things, always takes time. Knee replacement took a long time since the first one was started in late 1960s. It came to India after almost 1990, except for Dr. Khyati, and a few other people. And and similarly, these stem cell, PRP, and other regenerative technologies are very much mainstream in many parts of the world, and they are becoming mainstream in India. And there is no question whatsoever that all the elite orthopedic organizations like American Academy of Orthopedic Surgeons, National Institute of Clinical Excellence in England, equivalent of the European organizations, and British Orthopedic Associations, all those organizations will have to accommodate this in their guidelines.
Okay.
Of course, they will refuse initially, they will be reluctant, and they will say, oh, there isn't enough evidence, and that is fine. That's how the technology evolves and gets accepted. The best thing is there is no major side effects, like Dr. Gauri mentioned.
Yeah.
With knee replacement, 20% of knee replacement patients are unhappy. Now, if that is the case, and then another statistics from US as well as from India, that at least is the key two words here. 20% of knee replacements that are done are unnecessary. Now, if you just add these 20 and 20,
That's
that is 40%.
Yeah.
And with PRP or stem cell, you're not damaging the joint. The infection risk is literally next to zero. There is no cuts, and there is no anesthetic involved.
There's no dressings required.
There is no dressings. It's just a temporary patch which you remove after 24 hours at home. Once we inject the hyaluronate in order to keep the PRP or stem cell inside in a non-inflammatory background, we ask the patient to take it easy for a few days, but no bed rest.
No bed.
So people can go home after a couple of hours in the OPD. That's all. And I would definitely urge, because you have been part of the government system, and in a way you would still be associated through your colleagues and of course as an advisor, I'm sure, that the insurance companies in India need to be brought to the level where they approve some of the OPD procedures as a part of their insurance claim process, because in the long run it saves them money. Because if one person benefits from say PRP and hyaluronate injection for knee pain, that person is not likely to require knee replacement in the foreseeable future. Then the insurance company has saved the billing for the knee replacement.
Absolutely.
I mean, it would make financial sense. And I think this message needs to go in those government departments who are dealing with insurance companies.
Yes. So thank you, Dr. Butch. I had no clue about this aspect of it, but of course I do have colleagues still in the it's Ministry of Finance, and that's a separate division which looks
Yes.
after insurance regulation. It's actually an independent body, but I think it's very important that this message goes down to them. So I will do in my bit, but I think the podcast is equally important, and I hope it's viewed by very many people so that this message goes, uh, I mean, to all policymakers, whether they are insurance claimants, whether they're insurance policy makers, whether they're regulators, or whether they're just people who are in the field who are processing these cases.
As much as we can help through this.
Absolutely.
And sir, you just mentioned that these PRP therapies can also help sportsmen in sports injuries. So how, like which injuries, like specifically,
Okay.
if you can share?
So, first of all, there is a knowledge bank on this subject already, but I will also back it up with my personal experience with some of my patients. So, we have one table tennis champion of one of the states in India. I don't want to like necessarily identify that person because I haven't taken the permission to take a name or anything. And she had an ACL injury and she was brought to me in her 20s. And I said, look, these two are the options, but I think looking at your overall clinical stability of the knee, we could perhaps get away with using what is known as a leukocyte rich platelet rich plasma. For the cartilage, we use leukocyte poor platelet rich plasma. There are two different kinds of PRP. And so we did the LRPRP for her knee, and then I gave her a knee brace for ACL as well. And there is a specific physiotherapy program that we used, and she's been playing table tennis and doing everything, and her knee is absolutely fine. And every now and then either her or her dad contacts me and says she's doing great.
That's
um,
amazing.
yeah.
Wow.
And then we have a swimming champion who recently came with a double ligament injury in the ACL as well as medial collateral ligament. Now, isolated, perhaps either of them would not have required surgery. I accept that. But because there were two injuries, there was a possibility that she was probably understandable that advised surgery to get a faster rehabilitation, or the thought could have been given to that. Again, we injected both the ACL area as well as the medial collateral ligament, which is on the outside of the knee, with the platelet rich plasma. She also had some cartilage damage to the joint lining. So we also supplemented with sodium hyaluronate. And since then, she has been taking part in supporting, would you believe, international level sport events from
Wow.
India.
Very good.
So and there are a few other young lads playing soccer, and so PRP can help. Again, patient selection is very important, and the orthopedic surgeon, has to know what is the latest current credible evidence, not necessarily be misled by a bulk opinion or by the so-called guidelines of the professional bodies, because they take a long time. But what is the actual credible evidence in the peer-reviewed literature? So therefore, the surgeon has to be really proactive and really smart, and really up to date. And the second thing is the ethical aspect, that just because somebody trusts me doesn't mean that I should inject them with PRP or do their arthroscopic ACL reconstruction surgery or do a knee replacement. No, if somebody trusts me, I'm actually even more careful,
Yeah, sure.
because there are patients, some of whom or the families might be hearing this, that I have said to them, you don't need anything. You don't need x-rays, you don't need MRI scan, you don't need PRP, you don't need stem cell, you don't need surgery. You just need some physiotherapy. And I don't say just physiotherapy lightly, because physiotherapy is
It's
an
hard,
amazing science in
but
its
it's
itself,
hard.
and it has to be given time.
Yeah.
A lot of orthopedic surgeons in many parts of the world, I won't name the country because then I'll get into trouble, don't necessarily respect the physiotherapists at the same level of professionalism that They consider themselves to be. I think that is a kind of insecurity speaking.
Absolutely.
But it shouldn't be like that, because a lot of our orthopedic patients can be actually cured by physiotherapists even without needing our intervention, as long as the physiotherapists know their limitation, of course. So the physiotherapy, certain medications, and then say, okay, come back if your problem gets worse. Then if the problem gets worse, patient knows. Ghayal ki gat ghayal jane, people know where. And our job is to keep them active and mobile. Upanishad say, charai veti, remain mobile, remain mobile. And our orthopedic foundation, the Switzerland Association of Osteosynthesis, their mantra is also life is movement and movement is life. और अपना famous गाना है चलना ही जिंदगी है रुकना है मौत. So mobility is so important, you know, uh, and that is what we are here for.
So it's interesting, Dr. Butch, because I was just watching a podcast of the BBC, and they have identified what they call blue zones across the world in places like one part of America, one part of Japan, one part of Sardinia, that is Greece, uh, Costa Rica. There are blue zones. These are the places where there's longevity. And I mean, the point about mobility. So, the common factor among all these cases, all these, they're different races, different climate zones, uh, different food habits, but the one common factor that all the people, and this is where the average median age is 100 plus, the one common factor is mobility. All the people in all these places across the globe, I mean, there are 8 identified blue zones across the globe, all of them are people who are constantly mobile. So, yes, movement is absolutely important.
Yeah. So, that's where the Brian Johnson is working on. A lot of people consider him to be crazy, but it is only the crazy people who push the envelope, the disruptors.
The disruptors.
Yeah. The thing about the movement, and I'm really amazingly impressed and, almost heartwarmed by the description that you gave of the blue zone. And the movement side, begins from the very beginning. It is not that suddenly, but then some people say that, look, I have not done any exercise, it's too late for me. That's the other side of it. It's never too late.
Never too late.
You can always get into, and specifically the three areas, especially as we advance in age, is progressive resistance training, weight training, and balance training. And for that, you need your knees to be really, really good.
Healthy. Yeah.
Your elbows, PRP has been used for tennis elbow as well in certain patients, and for early rotator cuff disease in the shoulders as well, and plantar fasciitis, the heel pain. So there are quite a few applications.
So, sir, in the stem cells and PRP therapy, is there any role of physiotherapy after or before or during the procedure?
So physiotherapy, as probably hearing my earlier comment, you would have figured out, Khyati, that I put a lot of emphasis on physiotherapy, because to get the muscle strength, to get the balance, and to get what is known as a sense of proprioception, your joint belonging to the space. Physiotherapy is important. The first week after the PRP and stem cell, I don't recommend physiotherapy, but after second week, we have a structured program, and in India, we are blessed that we can have home physiotherapy services, which used to be the case in the NHS, National Health Service UK, some 40, 50 years ago. But they have lost all the good things in the NHS. I'm very sad to say that. One of the reasons why I left the NHS, because I was feeling I was more like a manager than a surgeon. And I was stuck with this. Initially, I liked the protocols. It gives a discipline and structure to the treatment. But when it becomes an albatross around your neck, then it actually restricts your ability to treat your patient as a human. That's what is happening in the British NHS. And that is what I like about India, that we have got the right balance between being innovative individual, and the most important thing in Indian healthcare is the doctor is directly accountable to the patient. There is no other agent in between. And that's where America, there is a lot of brainstorming going on. All these corporate hospitals and corporate owners, insurance companies, doctors want to start their own hospitals in US, And do you know what? The people who are opposing it the most are the insurance companies,
I'm sure.
because they don't want to lose the control over the
Control.
hospitals. So yes, physiotherapy is incredibly important, and it has to be done for a number of months. If you want to regain youth inside your body, you got to put some effort.
Yes. Yes.
So let's come back to the Gauri ma'am. Ma'am, for the stem cell therapy, like you did your own research or someone referred you or something like that. How did you just get to this therapy? Like,
Okay, so one of my earlier avatars, I was an IAS officer, and as you probably know, IAS officers do everything. We run the government departments, we run major PSUs, we run corporations, we run boards. One day we are serving food to children under a midday meal. The next day we are doing healthcare. The third day we are running fisheries. And the fourth day we'll be running in industry. We're jack of all trades. So in one of my earlier avatars, I was also Secretary Health, and I started reading about healthcare, and I said, let me try and modernize some of the hospitals because Bangalore was emerging as a major center for medical tourism. And I realized that there is a lot of uh, incentive and push needed in sports medicine, in regenerative medicine, especially for spinal, knee arthritis, as well as neurosurgical. And I realized that stem cells and PRP therapies can be effective in both these fields. In, as Dr. Butch said, in sports as well as in older persons who suffer from arthritis, both rheumatoid as well as osteo. So for that reason, I started reading about it, and I then chanced upon the Manipal group, which is doing cutting edge research in this, and that's how I then realized that they have now got into research on stem cells. They correct they were doing clinical trials at that stage, and later on I read that they have actually been able to manufacture a stem cell injection, which I was very happy, and which Dr. Butch administered to me.
oh, that's great to hear you. And sir, now tell us about like the how long does this procedure take? So patients and the public can get the idea.
So the PRP procedure, platelet-rich plasma, we just take a blood sample, like a normal blood sample, and it goes into the special orthopedic PRP centrifuge machine, and it comes out after about 15 minutes. And after that, we inject in a certain specific manner, and it requires a lot of experience and skill to inject it properly so that it goes in the space between the tibia and the femur. It doesn't hit the bone,
Yeah.
it doesn't go inside the ligaments, it doesn't go in the meniscus, it just has to be in the space. And there is a way of knowing, and only your tactile sensation can tell you that. And I don't like to say it like this because it's not always viewed positively or nicely, but it does take experience to
And
get that
skill.
feeling,
And
and
skill.
then skill, and you sort of build upon that. So that takes about 30 seconds, and then we inject the hyaluronate, which takes another 30 seconds. So overall the injection itself about no more than 1 or 2 minutes. For some PRP patients who are extremely sensitive about this needle going on their joint and are really frightened of needles, we give external local anesthetic very
Okay.
carefully, so that it doesn't penetrate the joint capsule and doesn't go inside the joint. Because if local anesthetic goes inside the joint and then you inject the PRP, then it will
Damages.
actually kill the PRP,
Yeah.
so, or the stem cells. So the technique of doing it, with regard to the stem cell, it comes in a minus 73 degree cryopreservation casket, and then it is thawed. And this is all scientifically proven. All studies have been done at different temperatures of minus. They are preserved. There are certain markers which will tell us whether the stem cell are actually functioning or not, and that has all been lab tested and checked by the ICMR and the DGCA in India and everywhere else. And then they are thawed to 37 degrees Celsius, and then they are injected in the knee. Some Because they are stem cells and they are pulled stem cells, we give anti-allergic injection before the stem cells, so that patients, even if they have 1% chance of developing allergy, they don't develop it. And then that takes actual injection about 30 seconds, and then we give the
Hyaluronate.
hyaluronate, which takes another 30 seconds. Then we ask the patient to just sit there or lie there for about 15-20 minutes,
Minutes, yes.
and then they can like go home, really. Yes. If you compare it with knee replacement, of course, there are day surgery knee replacements happening in US and Europe, but then it requires a lot of resources and huge amount of strong painkillers.
Mm.
And one of the issues in USA and Europe and UK is this massive addiction to painkillers.
Yeah, two pills.
The the opioids, the tramadols, and what have you, and the non-steroidal anti-inflammatories, which can damage your kidneys, which can develop your stomach, it can damage your heart. Here you don't need any of those. In fact, we actively discourage people from taking anti-inflammatory,
Any medication,
because
yeah.
that can damage the stem cells and the platelets. So they only take paracetamol, and so it's a whole package. You don't compare, like saying, oh, you can have a day surgery knee replacement. First of all, not every patient of knee replacement is suitable for day surgery knee replacement. Secondly, it requires massive resources. Thirdly, it requires huge amount of painkillers. Fourthly, it requires lot of follow-up uh, supervision of the patient in the correct environment, and then wound inspections, wound infections, so many other issues.
Yeah.
So yeah, when it works in a suitable patient, and the patient feels that the doctor has given proper knowledge to them, and the doctor actually is ethical about this, the choice I always leave with the patient and the family. I never try to emphasize that they should have PRP, they should have stem cell, or they should have knee replacement. No, my job, my kartavya is to
Give you
give
the
them
choice
proper information
and the choice.
backed by responsibility.
Yeah.
Otherwise, Google can also give you information, but backed by responsibility, and then backed by the skill to execute that decision,
Yeah.
and then patient can choose.
Yeah. But doctor, even for the stem cell injection, I think a very high skill was required by you. I mean, I didn't feel any pain at all, but I remember it going in.
Yes.
So I think there also it goes in between the.
Yes,
So
in between the, yeah, we have to be, because the space is in millimeters,
yes.
and the
So
needle is
that's
also in millimeters, so we have no margin of error actually. I mean, I give the injection almost as if I'm joking and
yeah.
correct, so that patient doesn't get nervous, but yeah, margin of error is literally nil.
Nelly, yes. Yeah. No,
We
and
try.
that needle was not thin. It was quite a thick needle.
Yes.
I watched that needle and I was thinking, oh, maybe I should have thought once more. I just came.
I think the patient's pain tolerance and
It's
positive
important.
mindset,
Mind, very important, yes.
and being well informed about the long term benefits, which you were. And so ideally we
Yeah.
would love to have patients who are as well aware and well motivated.
Yes. But also, I think the Indian mindset is ideal for stem cells or PRP because we come with a sense of calm, right? Because we are
Yes.
into more into yoga, pranic breathing, as a we are not like the West, which starts questioning every small thing. We accept a lot,
Yeah.
so we are very tolerant to pain. We are also very tolerant, or rather, we are very accepting of somebody who has greater knowledge. In this country, we've always respected. So, for example, I knew when I met Dr. Butch that I was extremely comfortable knowing that he has the skill set which I need for the stem cells to go to the correct place. So I think that is also a very Indian quality. So I think Indian patients, we are absolutely comfortable with alternative theories because it is part of our, um,
Yeah.
USP that we are very comfortable with calm, peaceful,
Yeah.
out of the box kind of therapies.
Approach.
That's why we are more innovative in the way we think also in this country,
Mhm.
because we have a very calm way of looking at things, because it's part of yoga, karma,
Yes.
things
Yeah.
like that. We are
Yes.
absolutely accepting. Yeah.
Yes.
So,
Okay. So, sir, we are about to wrap up the podcast. So, I would request you if you want to say anything to the audience looking this at this podcast, and when you too you want to share something or inspire people more, you can. So, just we'll go with you.
So one of the things is, when it comes to PRP, and because we have patients coming from all over the world, actually, from London, from Dubai, from Australia. There was a gentleman who flew in from Australia just for the PRP and hyaluronic injection. 5 days in Ahmedabad, he went back. Um and we get inquiries, obviously, from other parts of the world. Africa, of course, I have treated patients from Kenya, and of course, different parts of India. USA, they have this thing about FDA approval. Now, regarding the PRP, because it is your own blood cells which are used, what it needs and what it actually has is clearance for the PRP toolkit. Because the platelet rich plasma is not classed as a drug because it's not manipulated in any form or shape, it doesn't need FDA approval because it's not a drug.
yes.
So there are some doctors, even in US, who are not actually aware that PRP only needs FDA clearance for the technology which it has, and then it doesn't need an approval like you would need for aspirin modified tablet or for the COVID vaccine or whatever. So this difference between FDA, US FDA clearance and US FDA approval needs to be understood. The second thing is the patient has to be suitable for these therapies, and patient has to be optimized, has to be made suitable once the exclusion criteria are not there. So that is the job of the orthopedic surgeon, and then to see the patient through the recovery phase and give them the facts. There is nothing which is 100% in life. If you try and cross the road, you don't know 100% you will reach the other side.
Yeah.
So we don't give patients false guarantees.
Yeah.
Knee replacement is 80-20, and properly selected and optimized patients with PRP and uh, stem cell is also 80-20, but without the surgery.
Without the surgery.
And at some stage, if your arthritic process, the disease, overpowers the benefit of stem cell and PRP, you can always have that knee replacement. But if your knee replacement fails, you are into revision knee surgery, which is really very, very
Painful.
demanding,
Yeah.
challenging to the patient, expensive to the patient or to the healthcare system.
Yeah.
And therefore there is a wisdom in this, like Dr. Gauri explained that trying to preserve your natural knee joint.
Yeah.
So, Dr. Gauri ma'am, would you like to say something to
No, I'd just like to inspire more and more people to try alternative theories like this. And I hope, looking at me, I mean, I'm not somebody who's young, I'm not somebody who's very active, but I still think the stem cells have made my knees regenerate. And today I am relatively pain free. I have a relatively normal life, which I don't see in women of my age. Uh, you know, and I don't see, they I have also seen patients who have knee replaced, knee operations done, and they're fine. But I have seen many cases of knee replacement which are not successful. People my age group with my level of arthritis or my level of injury. And so I would urge people to go in for this theory as or this alternative source of recovery. As Dr. Butch says, that you can go in, if it doesn't succeed, you can go in for a surgery. But once you've had a surgery, then if it is not going to work, then you are really housebound or bedbound, then until you have another set of surgeries to correct that. And that is really difficult in terms of cost, in terms of time, and in terms of pain management. So please do think about it, or my viewers, and I would urge people to get in touch with the people who do this and see if it works for you.
So I'll just make a little correction to what Dr. Gauri said. I think you started by saying you are not young or active, but I would very humbly and politely beg to differ. You are very youthful and active, and that's because you see in our system, which you mentioned, the body follows the mind,
Mind, yes.
and you are actually a living example of that. The only other thing I would say is that although I've been all over the world practicing, working, including in India, Bangalore, and Mumbai also, I'm based in Ahmedabad. And because of various other setups that we have in Ahmedabad, international airport and everything, with the full medical tourism services. Um, so it is literally airport to airport kind of services that we have in Ahmedabad. So even if you don't have anybody known to you in Ahmedabad, don't worry. We have wonderful staff, female staff, and we get patients, females, one or two females just coming on their own from outside India, and they feel that say that we feel so much at home when we come here. So of course, India is a big country, and I'm in love with Bangalore. I'm in love with Mumbai and everywhere else. But my base is in Ahmedabad. So
Yes.
if you really wish to have this range of therapies, specifically the type of PRP we use at the moment in India, and I stand corrected, and I wish that it is available everywhere else. Adopted, I wish by everywhere else in India. Currently, we are the only ones who are offering the type
Okay.
of PRP and the dose of PRP, which the type of hyaluronic that we are able to offer in Ahmedabad. So, and we are so, in a way, there is a way of saying in our country, ki doctor to Bhagwan hai. But I have learned from Mahatma Gandhi's one of the quotes, and of course, there are many things about Mahatma Gandhi people don't like nowadays, but there are many things that we have to learn from him also.
Absolutely.
And one of the things he said that customer is your God. So for me, patient मेरा भगवान है,
Thank you.
क्योंकि वही हमको इंस्पिरेशन देते हैं.
Yes, yes, very true.
That's a very kind thinking, sir. And I would like to thank both of you, Dr. Kaur sir, Dr. Gauri ma'am, for coming to us and inspiring people and educating them. Thank you so much. And now we are wrapping up the podcast. So I will take all of your leave and bye guys. We'll meet soon in our another podcast discussing very, very educative and inspiring stories. So bye.